Hey everyone, Coach Kate here, and I have a few tips on how we can adjust our runs that can help us manage symptoms like leaking, pelvic pain and heaviness, or even joint pain like in our knees or hips. The first thing we want to look at is our stride length. Before we do that, I want to encourage you to break out your video camera and just record your warm-up runs to see kind of what your tendency is as far as your stride. Is your stride really long and out in front, or are you landing with your foot kind of more underneath your body? If your foot is landing way out in front of you, and this can be very common postpartum, we can look at actually shortening that stride length, and instead of taking these long strides to cover ground, look at taking quicker strides along with that shorter stride. That is going to be called our cadence. Our cadence is the steps we take per minute, and ideally we want to take somewhere between 160 to 180 steps per minute. It's a range and it will differ by individual. But in doing so, it can actually help reduce the stress of the impact that our body is undergoing while running. And when we hopefully help reduce stress to our body, that can hopefully help minimize some of those symptoms that we are experiencing. A couple things that can help this is one, just getting outside and practicing for 15, 30 seconds at a time with those shorter, quicker strides. You could also do a wall drill that looks like this. Another way that we can look at improving our cadence and our stride is actually using a playlist so that your body can actually acclimate to that rhythm, and so that you can improve your cadence, which will hopefully help with any symptoms that you are experiencing. You can use these tips for Friday's workout or anytime we're going on a run.